Hello and welcome to this CJSON podcast. My name is Luís Mendonça. I am a nephrologist and clinical investigator at St. João Hospital Center and Faculty of Medicine in Porto, Portugal. On behalf of my co-authors, I'm pleased to share the findings of our most recent work entitled The Impact of Glucagon-like peptide-1 receptor agonists on kidney outcomes, a meta-analysis of randomized placebo-controlled trials. GLP1 receptor agonists are a class of medications that have demonstrated significant cardiovascular benefits in patients with type 2 diabetes and those with overweight or obesity independently of glycemic control. Secondary analysis of these cardiovascular outcomes trials suggested that GLP1 receptor agonists may also reduce proteinuria. However, their impact on kidney disease progression has remained uncertain. The recent FLOW and SELECT trials have provided new evidence suggesting that GLP1 receptor agonists may slow the progression of chronic kidney disease. Therefore, we conducted an updated meta-analysis to evaluate the effects of GLP1 receptor agonists on kidney outcomes. We included randomized placebo-controlled trials that assessed GLP1 receptor agonists in individuals with type 2 diabetes or overweight, obesity, with or without CKD, and which reported kidney events as primary or secondary endpoints. The primary outcome of our meta-analysis was the occurrence of worsening kidney function and was defined in three different ways: doubling of serum creatinine, or a decline in GFR equal or greater to 40%, or a decline in estimated GFR equal or greater than 50%, according to which was reported in each individual trial. Secondary outcomes of our meta-analysis included the development of persistent macroalbuminuria and a composite of worsening kidney function or macroalbuminuria. Our meta-analysis included 8 studies, incorporating 8,572 participants, including data from the FLOW and SELECT trials. Regarding the results, we showed that GLP1 receptor agonists were associated with a statistically significant reduction in the risk of worsening kidney function, with a relative risk of 0.84 compared to placebo. Similarly, GLP1 receptor agonists significantly reduce the risk of developing persistent macroalbuminuria. The composite outcome of worsening kidney function or macroalbuminuria was also significantly reduced. Importantly, there was no observed heterogeneity in the treatment effect across subgroups based on baseline estimated GFR, albuminuria, or body mass index. Additionally, patients treated with GLP1 receptor agonists experienced a significantly lower risk of serious adverse events compared to placebo, with a relative risk of 0.96. So, in conclusion, our updated meta-analysis, which includes findings from the FLOW and SELECT trials, provides robust evidence that GLP1 receptor agonists reduce the risk of kidney disease progression in patients with type 2 diabetes or overweight obesity, regardless of CKD status. These results reinforce the potential role of GLP1 receptor agonists in mitigating adverse renal outcomes in these populations. Thank you for listening to this CJSON podcast.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.